What do you think the main treatment difference is between somebody who's 23, a young adult, and somebody who's in their 50s?
So it's part of the rationale for the Enlighten Early study is we're looking at people who are early in their treatment for that reason. Generally speaking, for people who are early in their treatment, we find that people will go to antipsychotic medications that have less of a side effect profile. So, less, some of the agents that might have less weight gain. The reason that we're interested in Enlighten Early is if you're able to demonstrate that 3831 also mitigates olanzapine-induced weight gain in a younger population, that potentially allows olanzapine and samidorphan to be used in younger people, whereas right now it's typically not used as a first line. In fact, guidelines for pediatrics are that olanzapine should not be used first line because of the weight gain.
Okay. So using that as a first line, how much of an impact do you think that would have if this is effective in this patient population? How much better would it be to kind of push this to the front of the line?
I can't speculate in terms of what it is that would mean in terms of increased efficacy in that population. But what it does do is it presents another option to patients, clinicians, and families that they might not normally have right now because of the weight gain liability of olanzapine.
Okay. Now, I have a couple more questions on the COVID-19 pandemic. Basically, the first one is, have we learned more about schizophrenic patients just by placing them in kind of a unique situation?
Yeah, so that's certainly beyond. The Enlighten 2 program was completed and this study was done in 2018. So this is beyond anything that, we've published on from a clinical research standpoint. And so, I run clinical research and we have ongoing studies with patients with schizophrenia. It's actually been, we've seen a lot of the same technologies that are used in clinical care being adapted, to clinical research, and that includes the clinical research that we're doing with patients with schizophrenia and bipolar disorder. So that's more of a reliance on using technology, using telemedicine. So the same changes that have happened in the clinic are happening in clinical research. So, that's as far as that I can speculate as a clinical researcher. I'm not a psychiatrist or a clinician. I'm not treating patients right now, but I can say that, the research that we're doing right now, the Enlighten Early study continues to enroll, but using some of these different, changes in the way that clinical care is delivered that, you see, across, multiple clinical areas, but it's certainly in psychiatry as well.
Do you think the end result, once we're through the pandemic, do you think more telemedicine features will be used in clinical research?
Yes, and again, this is beyond the 3831 program, but as a clinical researcher, yes, a lot of those technologies were being developed prior to COVID. Just as making clinical research more available to people, not having to have them, drive into clinics for the same reasons that, people have before COVID, opted to, whenever possible, email their PCP for a script refill or whatever. So the same things were already in motion. They've just been accelerated, obviously, so that if you were on the fence and you were like, oh, I'm interested in doing some virtual assessments in clinical trials, well, now suddenly, it's something that you have to do in order to conduct clinical research. So, COVID-19's affected everything, including clinical research. And, again, this is just my own opinion here, but I think that a lot of those changes will actually improve clinical research and will probably be here to stay.
Okay. And then my final question, if we could take it back to the ALK study, schizophrenia treatments, it's been difficult to find new drugs and new effective drugs. What makes this effective? What made it kind of a success going forward that other treatments, other studies have failed in the past?
Yeah, and it's actually very key to the 3831 program. So a lot of the, if you're following the paradigm of antipsychotics, a lot of the first generations had efficacy, but they had, horrible side effects. And then some of the early, second generations, they also had efficacy, but they had, different side effects. So you went from having movement disorders in the first generation to having, metabolic issues, weight gain, prolactin increases in some of the second generations. Then more recently, there's been a move to reducing those side effects, but sometimes at the cost of efficacy. So in terms of that gap there, the 3831 program was to, hey, there is a very effective medication in olanzapine that more people would potentially be able to use if it was not for the weight gain and the metabolic liability of it. So what's different about this program is that we're looking at proven efficacy from a compound that has been used, as I said, for 30 years with very well established efficacy, and we're not taking anything away from it. We're other than the side effect that the mitigating the weight gain.